Hi, my name is Carol Jamison, and I had breast reconstruction at Emerson Hospital after a breast cancer diagnosis. I was initially diagnosed by Dr. Susan Cahill at Emerson Hospital. It was she who performed my mastectomy. I didn't require any other treatment. That allowed me more opportunities for reconstruction. That's the real benefit of having your cancer diagnosed early. She referred me to Dr. Costas, who did the reconstruction and all of my subsequent surgeries to put my body back together.
I met Carol directly after her first diagnosis of breast cancer. Generally, the general surgeon sees the patient after the diagnosis, and then the patient's referred to us for reconstructive surgery. When I first see a patient, I think the most important aspect of our meeting is to find out what they want to accomplish with the breast reconstruction.
When I met with Dr. Costas, he provided me with options, and I was able to fully participate in that conversation at that point.
I discussed with Carol several options as far as breast reconstruction. Carol wanted the most aesthetic reconstruction, so we used her own tissue. That way, the breast moves and feels and looks like your normal tissue because it's shaped out of your abdominal tissue.
I ended up having a tummy tuck as part of correcting the surgical scar in my abdomen. I also ended up having some lipotransfer, which is where they take fat from one portion of your body and put it into another portion, and it was to fill in some spots on my new breast. I think it was a total of 5 procedures in 3 years. And what was nice is that Dr. Costas was there with me along the way.
Carol has made the most of her recovery. She's taken control of her situation. She's eating right, she's exercising.
Once I had the surgery and was cancer-free, it motivated me to take care of the body I'd been given. There is not one aspect of my life that has been untouched by this experience. It is something that changes you on the inside, so it changes the way you relate to everybody and everything that is going on around you. It has given me a whole lot more self-confidence. It's really led me to focus on maintaining my health, and that's not just for myself, but that's also for my family and everyone around me who really relies on me to be healthy.
I think we're very fortunate to have Emerson in our community because it delivers a wonderful level of care, and it's right in our backyard. Patients don't have to travel to Boston.
Having Emerson so close by meant that I was only 5 minutes from my home and my family could come visit me in the hospital. It also made all of the follow-up appointments, and there were many, very easy. It's easy to get there.
One of the advantages of having an operation at Emerson is it's a small community hospital. I know the general surgeons very well, the oncologists, the radiation therapists. We work together all the time. There's a good camaraderie amongst the staff. We all share the same records. We know what's going on with the patients, and we're all up to date with their latest care.
I actually felt like I was in the center of a whole group of people who were responsible and took that responsibility on willingly to take care of me and to help me get better and to help me stay better.
I'd come from training in a big New York City hospital doing breast reconstruction. And I found that the level of care here, as far as the technical ability of the surgeons and the nurses, was equal, if not better, than what I had previously seen. I think Carol's a wonderful example of why I went into plastic surgery. Not only have we reconstructed her and made her whole again, but also we've done some cosmetic things to make her happier.
Here I am in my mid-50s, and I am healthier than I was 10 years ago.